There is a spice sitting in most people's kitchen cabinets right now that has been studied by research teams in pharmacology, inflammation science, and metabolic medicine for decades. It is not trendy. It does not have a sleek modern label or a wellness influencer selling it at $40 a bottle. It has been in the same jar in the back of the same cabinet, used occasionally to flavor a holiday recipe, and then forgotten for months at a time. And what the research on this spice reveals, specifically what happens when 2 whole cloves are placed in warm water and allowed to steep overnight, creates a bioactive preparation that has produced results compelling enough to appear in peer-reviewed journals studying blood sugar, inflammation, liver function, gut microbiome health, oral antimicrobial activity, and even cardiovascular risk markers. The question is not whether this spice works. The question is why nobody told you exactly how to use it and what happens inside your body in the hours after you drink it. The answer to that question is more detailed, more specific, and more genuinely surprising than most people expect going in. Because when the mechanism is understood, when the specific compounds and their documented biological activities are laid out clearly, the reaction is not excitement about a miracle. It is a quiet and profound recalibration of something you always had access to, something your grandparents may have used instinctively, now explained in the language of modern biochemistry in a way that makes it impossible to dismiss as folk medicine. Stay with me, because what follows is going to change the way you look at that spice cabinet. And if this channel, Dr. Victor Lang, is the place where you want to keep getting health science explained in this way, hit like and subscribe right now. The community here is built on the premise that traditional wisdom and modern research belong in the same conversation. And what you are about to hear is exactly that conversation at its most compelling. Let us start with what cloves actually are at the biochemical level, because the spice that flavors your holiday recipes is, from a phytochemical standpoint, one of the most concentrated sources of bioactive compounds found in any common food. Cloves are the dried flower buds of the Syzygium aromaticum tree, and they contain a compound called eugenol in concentrations that are extraordinary by any pharmacological standard. Eugenol makes up between 70 and 90% of the essential oil of cloves, and its biological activities have been studied extensively enough that it appears in the literature not just as a flavoring compound, but as a pharmacologically active agent with documented effects on inflammation pathways, microbial activity, pain signaling, blood coagulation, blood sugar metabolism, and oxidative stress. In concentrated form, eugenol is used clinically as a dental analgesic and antiseptic, which is why clove oil has been used in dentistry for generations. But in the dilute form produced by steeping whole cloves in warm water overnight, eugenol leaches out gradually into the water along with a collection of other bioactive compounds including flavonoids, tannins, and oleanolic acid, creating a preparation that delivers these compounds in a slow, bioavailable form that the digestive system absorbs with remarkable efficiency. The overnight steeping process matters more than most people realize, and understanding why changes how you think about the difference between a quick clove tea steeped for 5 minutes and the preparation we are specifically discussing. When whole cloves are placed in warm water and allowed to steep for 6 to 8 hours overnight, the gradual, extended extraction process draws out compounds that a brief steeping does not reach, particularly the deeper structural polyphenols and the bound flavonoid fractions that require extended contact time to release fully from the dense fibrous matrix of the dried bud. The water temperature of warm rather than boiling is also significant. Boiling water degrades some of the more heat-sensitive phenolic compounds in cloves, reducing the bioactivity of the preparation. Warm water in the range of what feels comfortable to sip, around 140 to 160 degrees Fahrenheit, extracts effectively without destroying. The overnight preparation you strain and drink in the morning is therefore a meaningfully different and more potent preparation than a quick cup of clove tea, and the research that shows the most interesting results has consistently used preparations with extended extraction times. Now let us talk about what this preparation actually does in the body, beginning with the area where the research is most robust and the results are most clinically significant. Blood sugar regulation. Multiple controlled studies have examined the effect of clove supplementation on fasting blood glucose and post-meal blood sugar response, and the findings are consistent enough to be taken seriously. Clove compounds, particularly the flavonoids and eugenol derivatives, appear to work through at least 2 documented mechanisms. The first is the inhibition of alpha-glucosidase, an enzyme in the small intestine that breaks down complex carbohydrates into simple sugars for absorption. When this enzyme is partially inhibited, the conversion of dietary starch into blood sugar slows, reducing the speed and height of the post-meal glucose spike. This is the same mechanism targeted by certain diabetes medications in the alpha-glucosidase inhibitor class, which makes the finding that a common spice achieves a measurable version of the same effect through natural means genuinely significant. The second mechanism involves the improvement of insulin sensitivity at the cellular level, with clove compounds appearing to enhance the signaling pathway through which insulin facilitates glucose uptake into cells. In people with insulin resistance, this effect, even if modest in isolation, represents a meaningful biological shift in the direction of better metabolic control. A study published in the journal Metabolism examined patients with type 2 diabetes who received clove supplementation versus a control group and found that the supplementation group showed significant reductions in fasting blood glucose, LDL cholesterol, and total cholesterol over a 30-day period without changes to diet or other lifestyle factors. The mechanism proposed by the researchers involves both the alpha-glucosidase inhibition we discussed and antioxidant protection of the pancreatic beta cells that produce insulin. Beta cells are particularly vulnerable to oxidative stress, and their functional decline is a central feature of the progression from insulin resistance to frank type 2 diabetes. Compounds that protect beta cells from oxidative damage may therefore slow this progression in ways that extend far beyond the immediate glucose-lowering effect. But the blood sugar story, as compelling as it is only one dimension of what happens when this preparation enters the body. The anti-inflammatory effects of eugenol and the other phenolic compounds in the overnight clove water are documented across a range of inflammatory pathways that are central to the chronic disease landscape of aging. Eugenol has been shown to inhibit nuclear factor kappa B, commonly abbreviated as NF-kappa B, which is one of the master regulatory proteins that controls the expression of genes involved in inflammation throughout the body. When NF-kB is chronically activated, which it is in people with metabolic syndrome, cardiovascular disease, insulin resistance, and numerous other conditions that become more prevalent after 50, it drives a persistent low-grade inflammatory state that damages blood vessels, accelerates cellular aging, impairs immune function, and contributes to the progression of virtually every major chronic disease. Compounds that modulate NF-kB activation are among the most studied targets in anti-inflammatory pharmacology, and eugenol, delivered in bioavailable form through the overnight clove preparation, achieves this modulation through a pathway that has been confirmed in cell culture studies, animal research, and to a more limited extent in human clinical research. The liver is the next organ that responds to the overnight clove water in ways that the research documents with specificity. Eugenol has demonstrated hepatoprotective effects in studies examining liver injury from various causes, including alcohol-induced hepatic stress, chemical toxin exposure, and the oxidative stress associated with non-alcoholic fatty liver disease. The mechanism involves the reduction of lipid peroxidation, a process by which unstable reactive molecules attack and damage the fatty membrane structures of liver cells, as well as the enhancement of endogenous antioxidant enzymes, including superoxide dismutase and catalase, which are the liver's own primary defense systems against oxidative damage. In practical terms, this means that the overnight clove preparation creates a biochemical environment in the liver that is more resistant to the oxidative injury associated with modern dietary patterns, alcohol consumption, medication load, and the generally higher toxic burden that most adults accumulate over decades. For people over 50 or 60 whose livers are already managing elevated demands, this is not a trivial effect. The gut microbiome effects of clove compounds represent one of the more recently documented and genuinely fascinating areas of clove research because the mechanisms here are not what most people expect. Eugenol and the related compounds in cloves have selective antimicrobial activity, meaning they suppress certain bacterial species more than others. The species most strongly inhibited by clove compounds include several that are associated with gut dysbiosis, bloating, and chronic low-grade digestive inflammation. Meanwhile, the prebiotic fiber compounds present in the clove bud itself provide substrate that favors the growth of beneficial bacterial species. The net effect of regular clove preparation consumption on the gut microbiome is a shift toward diversity and beneficial species dominance that mirrors the changes associated with improved metabolic health, better immune regulation, and reduced systemic inflammation. This microbiome connection is particularly relevant given how central gut health has become in the emerging understanding of conditions ranging from blood sugar dysregulation to mood and cognitive function. The oral health effects of clove water deserve mention because they are immediate, locally specific, and something that most people who begin drinking this preparation notice within the first week. The antimicrobial activity of eugenol against the bacterial species most associated with periodontal disease and dental caries is well established, and it is the reason clove oil has been a standard component of dental practice for over a century. When the overnight clove preparation is consumed in the morning, it delivers this antimicrobial effect to the entire oral cavity and then to the upper digestive tract, reducing the bacterial burden in both locations. Chronic periodontal disease is, perhaps surprisingly, one of the most significant risk factors for cardiovascular disease because the chronic bacterial and inflammatory activity in the gums enters the bloodstream and contributes directly to the inflammatory processes that drive arterial disease. Anything that reduces the burden of chronic periodontal infection, therefore, has effects that extend well beyond the mouth and into the cardiovascular system. Now let us address the practical details of the preparation itself, because the mechanism is only useful when the preparation is made correctly. Take 2 whole cloves, not ground cloves, which lack the structural integrity that makes the long extraction meaningful. Place them in a cup or small vessel with approximately 8 ounces of water that has been heated to a warm but not boiling temperature. Cover the vessel lightly to retain the aromatic volatile compounds during the overnight steep and allow it to rest for 6 to 8 hours. In the morning, strain out the cloves and drink the liquid on an empty stomach before breakfast. The timing matters because drinking it before any other food maximizes the window in which the active compounds are absorbed in the absence of competing macronutrients. The flavor is mild and warming, not sharp or overwhelming, and most people find it immediately pleasant and easy to incorporate into a morning routine. Consistency over time is the variable that matters most. The blood sugar effects, the anti-inflammatory effects, and the microbiome effects documented in the research do not occur from a single preparation. They accumulate through repeated exposure, the way almost all nutritional interventions do, through the gradual shifting of biochemical baselines over weeks and months of consistent use. The people who report the most noticeable changes, better morning blood sugar levels, reduced bloating, improved energy, less systemic discomfort, are almost uniformly the people who made this a daily practice rather than an occasional experiment. The preparation costs almost nothing. The time investment is the 30 seconds it takes to place 2 cloves in a cup of warm water before bed. And the biological case for what it does during those overnight hours, and then inside the body in the hours after consumption, is grounded in enough clinical and mechanistic research to take seriously as a daily investment in metabolic and inflammatory health. There is something quietly profound about the fact that one of the most biochemically complex and pharmacologically active substances available for daily use has been sitting in the average spice cabinet for decades, waiting. Not waiting to be discovered, because traditional medicine knew what it was centuries before the research literature caught up. Waiting to be understood. Waiting for the research to accumulate to the point where the mechanism could be explained in the language of biochemistry, where the effects on NF-κB and alpha-glucosidase and beta cell protection and gut microbiome diversity could be laid out in a way that transforms a kitchen spice into something you look at with completely different eyes. That is what happened today. And what you do with this tonight, whether you place 2 cloves in a cup of warm water before you go to bed, is entirely in your hands. But the information is no longer missing. The mechanism is no longer a mystery. The preparation is no longer something you have to take on faith. It is something you can understand, something you can make yourself, and something the research suggests your body will recognize and respond to in ways that compound quietly and significantly over time. Tell me in the comments if you are going to try this tonight, or if you have already been using cloves in your routine and have noticed something worth sharing. The experience of the people in this community is one of the most valuable things in these comment sections, and what you share may be exactly what helps someone else decide to take a step they have been hesitating on. And please share this video with someone in your life who is managing blood sugar, dealing with chronic inflammation, or simply looking for something grounded in real science that they can do starting tonight with what they already have in their kitchen. The most powerful medicine is sometimes the one that has been within reach the entire time, waiting for someone to explain why it works.